So first of all, thank you all very, very much indeed for taking the time out of what I'm sure are your very, very busy schedules to join us. For those of you that don't know me, I'm Charlotte Lazard. I am a Policy and Public Affairs Officer at Care England, which is the largest and most diverse representative body for social care providers. So today I'm joined by Philippa Doyle, who is the Head of Social Care at Hempsons, for our joint webinar on the CQC's new single assessment framework. Philippa will be talking us through about how providers can ensure that their care services operate in accordance with the fundamental standards, how they apply to everyday practice, and also how they interact with the CQC's new framework. So this webinar comes as a result of a lot of discussions that Care England have had with our provider members about the concerns that they have around the single assessment framework and also how they can best prepare. So we thought that this is a really, really excellent way of trying to help providers kind of understand a little bit more about the way that they're going to be regulated under the new framework and also how they can help prepare. It's also worth noting that this is going to be one in a series of 4 webinars that Care England are doing with Hempsons. The dates for the next ones are TBC, but do keep an eye out on social media for those as well. This is also a repeat of the workshop that Philippa so kindly delivered at the Care England conference as well. So there may be some overlap if you attended that as well. So just before I hand over to Philippa, a very, very quick bit of housekeeping from me. If you're able to keep yourselves on mute during the presentation, that would be great. It just really helps reduce a lot of the background noise. We are going to have Philippa presenting for 40 to 45 minutes. So if you do have a question that arises during that time, please do use the chat function. And then we're going to open up to a short Q&A. Again, if you have any questions that you'd like to ask Philippa, you're very welcome to raise your hand or pop your question in the chat. Alternatively, you can email me your question and I can ask it on your behalf. I'll make sure that my email goes in the chat function in a moment. We're going to be recording this session and attendees can expect to receive a recording and also the slides and an FAQ document of the questions that we don't get round to answering in the coming days. So with that all out of the way, Philippa, it's over to you.
Thank you very much, Charlie. I'm just going to share my screen. So I hope everybody can now see those slides. If I could have a thumbs up from somebody to make sure you can see everything. Brilliant. Thank you very much. Okay, right. Well, what am I doing? Technology has failed me already. Okay, if I go up here. Right. So for those of you who don't know me, and I know there are some familiar faces on the screen that I've seen, my name's Philippa Doyle. I'm the lead partner in our health and social care advisory team. And as Charlie said, I actually head up the social care advice from Hempsons across the country. Got 25 years experience now, predominantly working with providers in an out of hospital arena. So whether that's primary care, community care, with lots of social care providers on quarter protection matters, information governance, and a lot of work on CQC, whether that's challenging them in relation to an inspection, or I do a phenomenal amount of training working with providers to ensure that your service is presented to CQC in the best possible way to help maximise your rating. So today's session focuses very much on the new CQC single assessment framework, and in particular on the quality statements or the WE statements. There is a lot of detail in these slides. I am going to skip over some of it because I'm acutely aware of time, but you will get a copy of the slides afterwards. And there isn't actually anything that I'll be slaying on the slides that isn't publicly available information already. I've tried to pull together information from lots of different sources from CQC's own website as well, to try and present this information in a sort of bite-sized pieces for you. So where are we now? As you will all know, the final go live date for everybody has now passed. It was over 2 months ago now, on the 6th of February. So if CQC turn up tomorrow, or indeed if they turned up this morning, they will be, in theory, inspecting you under the new regime. And that is supposed to be what they term now an assessment rather than an inspection. It's supposed to be a 2-part process. It's supposed to be a paper-based analysis that they ask you to submit lots of information in advance through the portal if they actually get the portal up and working properly. And then there will be cross the threshold observations. So when they're actually in your service, they ought to be spending the time observing and talking to your staff, not doing a deep dive in relation to paperwork, which of course was always the process in the past. I have, however, been told from a number of sources that because the portal isn't up and running yet, and so they haven't got themselves sorted in quite the way they would have liked in relation to collecting that information in advance, that the new assessment process, for some people, the feedback has been, well, actually, it felt no different to the old inspection process. They came mob-handed. One of them locked themselves in a room. They were firing questions at us, wanting paperwork, wanting access to policies and procedures. And it really, as I say, didn't feel any different to the old process. But CQC will say, well, you know, we're still in the early days. We're still phasing everything in, and in time we will get to where we want to be. So this session is very much focused on what is supposed to be happening with the new CQC process. So as I say, two-part paper-based information uploaded in advance. They're still asking for you to complete a PIR. They have indicated that they will tell you what information they are looking for and what they want you to provide. So in theory, by the time they come to cross the threshold, it should be more relaxed. It should be them sitting in a corner, observing care, talking to the people that you support, talking to your staff, not the approach that many have seen over recent times. Very much likely to be more onerous for them, with their new assessment teams grappling with a new system, rather than for you. It should just be business as usual. There's no change to the regulations. There's no change to what CQC should actually be asking to see. You don't have to deliver anything in a different way. You don't have to do anything differently. You just have to still continue to strive to deliver the best quality care. It should just be a business as usual type situation. But of course, the reality of it is that within your services, you'll be looking at different ways in how you answer the quality statements and how you present the information to get the best possible outcome for your service. And so in relation to these quality statements, I think everybody knows that there are 34 quality statements rather than the old 303 key lines of inquiry that they used to have. And initially, we were told by CQC that we're only going to assess 5. And if you've looked at any of the new style reports that are on CQC's website, those initial ones pre and post Christmas, they did only look at 5 quality statements out of the 34. Then we were told, well, actually, we're going to look at 11 quality statements. We're going to get a better handle on your service rather than just picking 5. And then I read something on a CQC blog last week saying, actually, stop asking us how many we're going to look at. We're not going to nail our colours to the mast and pick a number. It is going to vary, and we'll decide how many quality statements we need to look at within your service and how we're going to assess you. My underlying understanding is that quality statements are going to be assessed by reference to the soft intelligence that CQC have gathered about your service. So a little bit like the way that they've been led and driven as to what services that they were going to inspect post-COVID, that they would do it on a risk-based analysis. That's still going to be there to a certain degree because they'll be getting information from your local authority commissioners, your NHS commissioners. They'll look at how many direct complaints they've had to CQC themselves. They'll look at any whistleblowing referrals. They'll look at the notifications that your service has put into CQC, and they will use that to assess and determine which quality statements they are going to focus on and which they are going to look at and do a deep dive on in relation to your service. So the one thing that I would say to everybody, if CQC did turn up this morning, if they turn up tomorrow, make sure you ask them at the outset which quality statements it is that they are actually assessing you against, because it is unlikely to be the full 34. And if you are clear with them at the outset, and they should tell you, they've got no reason to not tell you, then at least then you can be clear in your own minds which areas you need to focus on and what is the best quality information that you can present to them on the day if you've not had the ability to do that beforehand, or if they've turned up obviously on spec and you weren't expecting them. I think everybody also knows that points now mean prizes. So whereas previously we weren't always 100% certain how CQC had reached a particular grading in any one of the 5 domains, the 34 quality statements are now scored between 1 and 4, depending on the quality of the evidence that's submitted to answer each question. So you as a provider in time will get to know in response to each question that you're assessed against, whether you've scored 1 for inadequate, 2 for requires improvement, 3 for good, or 4 for outstanding. And then across the whole domain, so if we look at, say, safe as an area, you will then be very clear on what your percentage score is for that area and whether you have got requires improvement or good, whether you've just missed out on a good or just tipped over into a good. And because you'll know what your point scoring is in relation to each question, you'll have better clarity as to whether you've got a particular area of weakness that you need to focus on. And again, the theory is that if you have dropped some percentage points in one particular area, you can focus on the work that you need to do and then resubmit evidence to CQC to get that rating bumped up in time. And so once the systems are bedded in and are sorted, if there's been a particular problem or a bit of a blip, or a member of staff had an off day, or your register manager wasn't there and nobody could find the policies and procedures to share the right information with CQC, that you will be able to rectify that, resubmit the information through the portal, they will reassess it and will change your rating, hopefully, in a more timely way. Obviously, something that never ever used to happen in the past. You used to have to wait for the next inspection. And so you could end up with some very stale ratings for quite a long period of time. There is no expectation, probably for about a year, that CQC will actually properly have this reassessment system up and running, and that it'll be able to work in kind of the quickly, timely way that they're anticipating. But that's the direction of travel, and that is what that's what they're looking for. Just a note of caution in relation to those ratings as well. If you have got perhaps one area where you're scoring 3s and 4s, so you're looking at being rated good in that area, but for some reason you have a real blip and you score 1 on something. Say your IPC for some reason has gone completely out the window, and you score a 1 on that in the safe domain, but everything else is scoring 3s and 4s. CQC will limit that rating to requires improvement, or if you've been scoring 4s on everything else and you score 1 or 2 on one quality statement, then your rating is going to be limited to good. You're not going to be able to get that outstanding. But whereas previously under old reports, you might have sat there and read it and thought, well, 95% of this is all absolutely brilliant. And there's one tiny little paragraph that, has got some negative comments in it. And yet I've still been rated requires improvement. What's that all about? At least now you will actually be able to very clearly see, yeah, I have scored good in relation to everything. I've maybe got some outstandings on some questions, but we really fell down on this one area and we've only scored a 1 on this one area. And that then gives you that real clarity as to why your service has been pulled down in that particular area, which I think is better from a transparency point of view, that not only can you see where the specific deficiency is that you need to address, but also members of the public, the people that you support, potential families can see, actually, I know they've scored requires improvement under safe, but actually all of these are really positive comments and they're all really good scores. It's just this one particular area that let them down. And, CQC were obviously bothered about that, but I'm, not that concerned, or I can see that they're dealing with it. The other thing that CQC are now telling us as well is they're talking a lot about evidence categories. And there are 6 different evidence categories. And what these evidence categories actually are just themes, for want of a better word. Different themes that are attached to each question, where CQC will be looking to collect the evidence or collect the information out of that particular area. So we've got 6 evidence categories, but only 5 of them actually apply to social care providers. One of them, outcomes, is mainly just for NHS services. And the evidence categories and the themes again, are things that we are well used to in terms of information sharing to CQC. It's just being badged in a different way. So as I've said on the slide, we've got people's experience, feedback from staff and leaders, feedback from partners, observation and processes. And I have put the detail on the slide, so you will get these after the event, but I just thought it was useful just to skip through them very briefly in the context of what we're talking about. So people's experience is obviously going to be all types of evidence from people who've got experience relating to a specific health or care service or a pathway across services. So if you're a provider, say you're a patient transport service who transfer people from hospital into a care home setting, CQC aren't just going to be assessing your service, they're going to be assessing how joined up you are with the hospital, and then how joined up you are with the care home that you're delivering somebody to. Or if you're a dom care provider who is also working with the district nursing service or with speech and language therapy or all sorts of other services in the community, they're not just going to be looking at your service, they're going to be looking at that pathway and that interaction between different services. So with evidence from people who are using the service or a pathway, and also evidence from families, from carers, and from advocates for people who use those services, fully appreciating that sometimes the people that you support aren't able to articulate how well the service operates for them or what the deficiencies are. And CQC give us a definition as well as to what people's experiences means. So that's a person's needs, expectations, lived experience and satisfaction with their care, support and treatment. So it includes access to and transfers between services. So it's not just how the hands-on care operates, it's the whole holistic experience of engaging with your service that CQC are looking for when they look at people's experience. Feedback from staff and leaders is the next evidence category. So that's going to be evidence for people who work within the service. This also applies to local authorities and integrated care systems as well, who are also being assessed now under the single assessment framework. And it also provides access to groups of staff involved in providing care to people. It's also going to include evidence from those in leadership positions. So what we're looking at is the results from staff surveys and feedback from staff to their employers. And I've highlighted that on the screen because feedback is very much one of CQC's buzzwords at the moment. If there is one thing that you take away from this session that you should go away and do, that's to get feedback from staff and the people that support the people that you work with, but also get feedback from families, from the people that you support, from other professionals coming into your services, basically feedback from anybody and everybody. And then analyse that feedback and use it and show how you're sharing that within your service and how you're feeding it into the modelling and the development of your service. CQC absolutely love feedback at the moment. So, please do that, push that as much as you possibly can. They might do some individual interviews with your staff. If you're a much bigger service, they might do some focus groups with different groups of staff. They might also have some interviews with leaders within the service. So that might be the registered manager, it might be the deputy. If you're a bigger organisation, that might be talking to charity trustees, board members, senior members within the organisation. They can really talk to anybody within your organisation. They'll look at any feedback from people that's been sent directly to CQC through a give feedback on care service. And they'll look at whistleblowing. I've got one client on the call who he knows that I'm talking about him and he's looking at me now, who has always said to me that all staff members need to be reminded that every single point of contact with CQC should be seen as them assessing your service. So all staff members should be really mindful of all of their interactions with CQC and with anybody else. Even CQC ringing up to make an appointment if you are a service that's lucky enough to get advance notice of them coming in, because of the types of people that you support, that they need to make those arrangements in advance. Even that initial conversation could be seen as CQC assessing how responsive you were over the phone, how you engaged with professionals, how you engaged with CQC. So all staff should be really mindful of that. Feedback from partners is the next evidence category. That's evidence from people representing organisations that might interact with your service. So that might be commissioners. It might be other local providers. You might be asked to comment on, your neighbouring provider or a competitor, the service down the road. You might be asked to comment on the district nursing service. The district nursing service might be commenting on you. Can literally be, anybody and everybody that is professional who engages with your service. And then you've got observation. So that's when CQC are actually physically in your service. And so they're going to be observing care. They're also going to be observing the care environment. And they do stress that will still remain a very important way to assess the quality of a service. It can't all be done by paper-based analysis in advance. Most observation is going to be carried out in person on the premises, what CQC call crossing the threshold. Physically, the threshold of your premises rather than any kind of artificial layer. And it's going to be carried out by CQC inspectors and by specialist professional advisors. You might also find that there will be other external bodies who might carry out observations of care and provide evidence. So I know some local authorities, local health watch services are more active than others in terms of going around services and carrying out observations and collecting evidence. I have seen in some parts of the country where that evidence has then been shared with CQC, and CQC will then include that specifically in this category rather than in the people's experience category. It's almost like they've had somebody else do some of the legwork and collect information for them. They won't be using this in relation to local authority assessments, but we're not obviously that worried about what's going on in local authorities at the moment, particularly with all the announcements about things being paused. But all observation is going to be carried out on site. So if you're a traditional bricks and mortar care home type service, then they will come in and announced in the same way that they did previously. If you're a service supporting people in their own homes, where there's a need to give advance notice because you need to make best interest decisions about people going into different services, then you are going to get that little bit of warning, possibly, Friday afternoon, we're coming in on Tuesday kind of warning, that they're coming to your service to do observation. And so again, particularly in this context, while CQC are on the premises, whilst they're talking to the people that you support, every interaction by any member of staff is potentially going to be CQC assessing your service. So all staff should be very mindful of their interactions and how they're presenting themselves, which of course should be professional at all times, and they should have nothing to hide. But people do tend to go to pieces a little bit when the auditor comes in. And the final thing for your services to be concerned with is processes. And that's any series of steps, arrangements, or activities that are carried out to enable a provider or organisation to deliver its objectives. Basically, we're looking at policies and procedures here. This is very much aimed at the well-led section of the CQC inspection process. And the assessments are going to focus on how effective policies and procedures are. And so to do that, CQC are going to look at information and data sources that measure the outcomes from processes as well. So ultimately, they're looking at audits. They love an audit. They've always loved an audit. They still love an audit. They love an audit that identifies some deficiencies, and then they love an action plan that's going to deal with those deficiencies. But don't do an action plan that's got 100 actions on it and is 1 million pages long. Keep them very short, keep them very focused. Pick your top 10 items, or if you've got bits and pieces all over the place, then say, right, we're going to focus on this area for this month, we're going to focus on this area for the next month. Be very clear as to how you're measuring your audits, how you measure what you're doing with that information, and that you're then producing very clear action plans. Be very clear on what your learning points are out of incidents and notifications. Again, it's all very well recognising an incident, filling out the form, doing your notification to CQC, but that's not the end of the process. They want to know how you're measuring those notifications, whether you're looking at themes and trends, whether you've changed the operation of your service in response to those notifications. Very much kind of auditing and learning. And that standard phrase that, you know, if it's not written down, it didn't happen. Good documentation, good governance ultimately is the route to a good rating. If you haven't got your documentation there, if you haven't got it written down, you can be delivering the best service in the world. But if you can't evidence it, then CQC can't score you and you can't get that good or outstanding rating on that point. I'll skip over outcomes because it is only NHS focused and I'm very conscious of time. So before Christmas, CQC produced some handy little individual PDFs. So there was one for care homes, there was one for dom care services. Unfortunately, I pulled them off before they disappeared. What we've now got on CQC's website is a 109-page document that pulls together all of the quality statements. Brilliant. Gives you subtopics, lists which regulations are relevant to which quality statement, and gives you lots of guidance and lots of links, which is brilliant. Except remember that this single assessment framework applies to every single provider that delivers a CQC regulated activity. So this is not just aimed at social care providers. This big lengthy document is also aimed at the biggest hospital trusts and a specialist cancer service and a mental health service and GPs and dentists and everybody else in between. So although you've got this brilliant document with all of this lengthy, helpful information in it, you've still got to pick through what's relevant for you and what's irrelevant. So what I'm trying to do in this webinar and in the ones coming up as well, and in some articles that I'm writing as well, is to distill what information you as social care providers really need to know. So we've still got the 5 domains, we've still got safe, effective, caring, responsive and well-led. It's potentially easier to work with because we have only got 34 quality statements, not the 303 key lines of inquiry and ratings characteristics. But when you start pulling apart each quality statement, you start to realise that they've merged lots of information together. So one statement, when you look at it, has got lots of different facets to it. So what I've done is I've looked at the very first quality statement. It's under the safe domain and it's about learning culture. And the quality statement says we have a proactive and positive culture of safety based on openness and honesty, in which concerns about safety are listened to, safety events are investigated and reported thoroughly, and lessons learned to continually identify and embed good practices. Okay, right, well, you know, we can do all of that. But when you pick it apart and you look at what evidence we've got within our service that we've got a proactive and positive culture, concerns are listened to, safety events are investigated, safety events are reported, lessons are learned, we look at identifying and embedding good practice, you suddenly realise that there are loads of different parts that we need to evidence in a slightly different way. So CQC helpfully in their big 109-page document tell us about the different evidence categories that they're going to look at in response to this question. So they're going to get feedback from partners. So that's going to come from your commissioners. And then they're specifically going to be looking at processes. So they'll look at your duty of candour records. They'll look at evidence of learning and improvement. They'll look at your incident and your near misses and your events records, all of which is going to be information that you've got within your service, but it might not all neatly sit together. It might sit in different locations or in different parts of your internet or your IT service or your files, because they're dealing with slightly different scenarios. CQC then helpfully tell us what this quality statement means to them. And so they give us lots of information again. And what they're wanting to see is that safety is a top priority in your service that involves everyone, including staff as well as people using the service. And they're looking for the culture of safety and learning. So they want to see that there's openness and transparency and learning from any events that have put either people that you support or staff at risk of harm, or that might have caused them harm. They're looking for evidence that risks aren't overlooked or ignored, that they're dealt with willingly as an opportunity to put things right, to learn and improve. When I'm doing training, I talk about a child spilling Ribena on a white carpet or an adult spilling red wine on a white carpet, that if you mop that up and put salt or white wine or any of these other things on top of that Ribena or red wine straight away and deal with the problem, you can stop it spreading and ruining your carpet so that you end up having to put a pot plant on top of it, and then you just hide it from everybody. And it's exactly the same thing as to what they're looking for here, with safety and culture and learning, and that if somebody does something wrong, they're going to put their hand up straight away and go, oh my God, this has happened, please can somebody help me fix it. So it's not about something going wrong. It's about how the people, how the staff, how the organisation responds to something going wrong. That's what CQC really want to see the detail of. They want to know that, you know, the person is safe as well, and that you anticipated that there was the potential for this particular event to happen. So it's very much around those risk assessments. When something does go wrong, then how you respond to that. They're wanting to see, as I say, that people and staff are encouraged and supported to raise concerns. They're going to tell us when they've spilt that red wine or something's gone wrong, and that they feel confident that, you know, their mother isn't going to drag them out into the hall and give them a dressing down because they've spilt something on a white carpet. Can you tell I was scarred as a child? Or that, you know, they're actually supported to say, do you know what, it's not a problem. I'm glad you told me about it straight away. We can fix this. We can deal with this. Don't panic. They want to see that raising concerns is done in a proactive way. It identifies and manages risks before things happen, that incidents or complaints are appropriately investigated and reported, that there's that learning from complaints, that you do that analysis, that you change and develop your service going forwards. And that lessons are learned, as I say, feedback. They're really big on feedback at the moment, that you get that from staff, that you get that from people, that you get that from families, that you get that from other professionals, so that you can constantly learn and develop your service. And that's how you can really show that kind of embedded safety, and, you know, that culture of learning. So they give us some topics as well. They mention organisational learning, continuous improvement, duty of candour, all the things that I have mentioned. And so if you then treat that and translate it across into the regulations, there are some that jump out straight away. So straight away you can see that duty of candour is engaged, that, you know, regulation 20 is important. And so there are some real quick wins to make sure your policy is up to date, make sure your staff have all had training, make sure your staff know what a notifiable safety incident actually is and when duty of candour is actually engaged. Within social care services, we don't see duty of candour formally engaged in quite the same way as they see it in the NHS. You see lots of services that talk about duty of candour all the time and talk about, oh, I'm going to make a duty of candour phone call to a family member because X, Y, and Z has happened. And they're using it in a very colloquial way. If you're talking about duty of candour, then duty of candour has actually been engaged as far as CQC are concerned. They expect you to follow through your full process. They expect you to follow through, do an investigation, do a report back and a final letter to the family. And if you haven't done all of that, then there will be a line in your report saying, you know, duty of candour wasn't properly fulfilled. If you've ended up putting yourself in a situation where you've treated something as if it was a duty of candour situation, when in fact it wasn't, because it didn't meet the threshold, then you've kind of been, you know, hoisted by your own petard. So do be very, very careful. Do make sure your policies and procedures within your service are very clear as to when it's actually engaged and when it isn't, so that you don't end up tripping yourselves up. Regulation 17, good governance, is nearly always engaged on everything because that's the well-led element. They're wanting you to assess, monitor and improve the quality and safety of services, assess, monitor and mitigate risks to health, safety and welfare, maintain secure, accurate, complete and contemporaneous records, seek and act on feedback and evaluate and improve your practice. There's almost a checklist that the regulation gives you to work through, that if you're compliant with the regulation and you can demonstrate that you're compliant with the regulation, you've got a whole chunk of evidence that is already ready to show how you are compliant and how you've got that safety culture in response to this first quality statement. So as I say, they're looking at audits, they're looking at action plans, they're looking at meaningful progress. Don't try and fix everything, because you won't end up fixing anything. Give yourselves a top 10 list of things that you're going to do in a really timely, measured way. Get them all done. Show CQC that you're getting them all done, and then move on to your next top 10. And that way you will actually progress through everything. Regulation 12, safe care and treatment, that gets pulled into everything. Risk assessments, doing all you can to mitigate risks, ensuring people have got the necessary qualifications, skills and experience. Concerns about safety and being able to evidence a culture around safety are always going to link back to Regulation 12 and whether you're delivering safe care and treatment. It's always going to look at those risk assessments, how well the risk assessments are carried out, how the risks are mitigated, how staff respond to the management of those risks. All stuff that you will already have in your service, you will already be doing it in your service. It's about capturing it and pulling that information across to utilise to answer the different questions. And there will undoubtedly be a phenomenal amount of repetition as you work your way through each quality statement. So if you're thinking about maybe putting files together or portfolios of what evidence we've got to answer each question, you will probably find yourself duplicating what information is going against which file, because there is a phenomenal amount of overlap. Regulation 13, safeguarding, again, is always going to be linked into that culture of safety. Service users have to be protected. So systems and processes have to be established and operated effectively to prevent abuse and investigate potential abuse. And obviously the outcomes of investigations are going to form part of your learning and part of your culture of safety and continuous learning. The same with complaints. Regulation 16, complaints must be investigated and necessary and proportionate action taken. If you've got documentation within your service, if you can demonstrate that we're responding to complaints, we're analysing complaints, we're using that data to inform how we deliver care going forwards, all of that is evidence and information that can go against this quality statement to present your service in the best possible light. Regulation 18, staffing, and Regulation 19, fit and proper persons. Again, all of that is feeding into evidencing delivery of safe care and treatment, culture of learning, culture of safety. You've got suitably qualified, competent, skilled and experienced people. They're getting appropriate support, training, professional development, supervision and appraisal. They're supported to obtain further qualifications. They're of good character. They're, by reason of their health, after reasonable adjustments, capable of properly performing the tasks. Lots of things that you do without even thinking about, or that different teams within your organisation do, that will be evidence that you can pull in to respond to this one question. So what I would say then as an overall conclusion, and I've skipped through very quickly, is that there is an awful lot of detail to pull together. And I've only looked at one quality statement on this call. On each of the future webinars that we do, I will look at one or two other quality statements and do a very similar analysis, going through what CQC say you've got to provide, what regulations are engaged, and what you need to think about with those regulations in order to present evidence in the best possible way to answer a quality statement. Everything that you do in your service will probably already be great, but the quality statements frame questions in very different ways to the way that the key lines of inquiry used to frame questions. So I know some services who used to have little folders to provide the evidence to respond to every single one of the 303 key lines of inquiry. And so some services might now say, right, okay, well, we're going to look at each of the 34 quality statements and look at how we present that evidence in a very different way. What I want to do is just remind you that the regulations haven't changed. What you do hasn't changed. What has changed is the way that CQC assess you and the way they collect the information. And that means that you might have to present your information and present your evidence in a different way. Always challenge CQC. Don't ever accept anything that they say at face value, because there are invariably inconsistencies. There's been a misinterpretation of something that might have been said on the day. There might have been gaps missed of something really important that they should have been looking at in relation to your service that they just didn't see. Don't accept draft reports at face value. As I say, please do put those challenges in. Do use the factual accuracy process. It is still going to be there. CQC themselves have said that they are expecting a high level of challenge in year one. And I think that's why there's been a real slowdown of reports coming onto their website, because people who have been through the new process are more challenging than ever before to ensure that report is a fair reflection of their service, particularly where it's a part and part assessment, where they might only be looking at as I say, 5 or 11 quality statements, and they're relying on historic data to respond to the other quality statements. Please do contact us if we can assist in any way. We do offer half an hour's worth of free advice for Care England members, so please do pick the phone up or send us an email. Very happy to sense check your thoughts, point you in the right direction, or guide you if you need any more detailed advice on the process. But otherwise, that's me. That was a little bit of a whistle-stop tour, but as I say, that was just looking at one quality statement, and I am going to repeat this exercise probably in future sessions, looking at maybe 2 quality statements in each session, just to give you that breakdown and my thoughts on how the different regulations are engaged. But if there are any questions in the chat, or if anybody wants to stick their hand up, then I'll hand over to Charlotte back at Care England to facilitate that. Otherwise, thank you very much.
Thank you so much, Philippa. That was really, really positive, and we got some nice feedback in the chat as well for you. I did receive one question via email about working with third-party services. It's something that you mentioned towards the start of your presentation. What is the instance whereby if the third-party service that a provider isn't working for maybe isn't up to par, is it the provider that is also subject to being penalised as a result? What are you able to shed a light on that?
It's the operational status of another service should not impact on you. But we all know the reality is that sometimes it does. And so what CQC will be looking for is how your service manages the deficiencies of others. So if you know that there's a service that you have to work with relatively who are quite, low par, or they're not very good at certain bits and pieces, CQC will be looking for how you manage that situation so that it doesn't impact on you and it doesn't impact on the people that you support.
Great, that's really helpful. Thank you, Philippa. Suresh.
Yeah, my name is Suresh. I'm the director of a group of nursing homes. Some of the nursing homes have inspected in the past, and they are required improvement. The last time the CQC has visited was 2020. So they haven't visited for more than 4 years. Where are they going to start when they visit these organizations which requires improvement required? Are they going to start with a scratch piece of paper, or are they going to look back and see what happened in 2020? So where is the starting point?
So the starting point is the soft intelligence that they gather now. So they'll take the 2020 report as a baseline. They'll look at what feedback they've got from other organisations, what feedback they've got from the local authority, whether they've had any concerns presented to themselves as to whether there are particular areas that they are going to focus on. They'll also look at where the primary deficiencies were in the 2020 report that caused you to be rated requires improvement, and they'll look to see whether there has been improvement in relation to those particular areas. So they are still adopting a risk-based approach of looking at the problem areas first, rather than necessarily looking at what you do really well. They're looking to see that problem areas have been addressed, or if there are deficiencies that are identified through their soft intelligence, how you're dealing with those deficiencies.
Are they still going to bring the expert by experience person as part of their observation process on the day?
Potentially. It depends if say, for example, they've had a number of concerns come through about medication management, then you can expect that they will turn up with a pharmacist specialist advisor who will look specifically at medication. If there's been no particular concerns raised by anybody in relation to medication, then you probably won't see that kind of deep dive from a specialist. It will very much be driven by their pre-analysis of your service before they come through the door.
Okay, are we expected to see anything through the portal before they visit us? Do we have any indication? Once upon a time, we used to get PRIs and we used to complete them, and now that's all stopped. And are we going to get any information about their visit?
Yeah, so they have said that they are going to still use the PIR process. And once the portal is properly up and running, the way it's supposed to work is that they will ask for information from you in advance, and you will provide lots of documentation in advance. And only after they've had that information will they then come and cross the threshold to do observations on the service. But what's happening at the moment, because the portal isn't fully operational and because they don't have enough staff yet, the assessments are still operating in a very similar vein to the old inspections.
Thank you for answering my question. Thank you.
Pleasure.
We had another question in the chat about the portal, but I think that may well have been answered, and I can kind of concur with what Philippa said. We had the CQC attend a Care England membership meeting just the other week, and they said that they are obviously still working to remedy the problems with the portal, but they have said that if providers continue to face problems, then to please do let organisations such as Care England know. We're able to passport that information through to CQC so they can have a real-time picture of the issues that providers are facing. They've also said that if providers are unable to access the portal, they should continue to submit notifications via email if time is of the essence. Are there any more members? We've got a question actually from Victoria in the chat. Is it likely that they'll focus on one or two categories and the quality statements within them, or look across the 5 categories to include all the quality statements?
The quality statements that they look at will be driven by the soft intelligence that they have around your service. My general feeling, if they're going to focus on any areas, is that they will start with safe and with well-led. Because if you get safe and well-led right, then everything else follows. And those are certainly the primary areas that if any service needs to focus on anything, they should focus on those areas. The responsive and effective tends to flow from how a service operates anyway.
Sorry, it's me again, Suresh. How are we going to receive the slides? Are you going to email us or the recording and the slides?
Hi, Suresh. Yes, yeah, that's right. So all attendees will receive a video recording of the webinar and as well as the slides as well.
Thank you.
And we'll get that to you as soon as we can. Does anybody else on the call have any further questions for Philippa? If not, then I think we can look to close the meeting. Philippa, thank you so much.
There's one more in the chat, Charlie.
Is there? Sorry, what did I miss, Rich?
Hi, Charlie. For information, an issue we're facing is that the CQC are rejecting managers' registration applications, saying they must be submitted via the portal, but we haven't been able to use the portal. I think you probably covered that, but it might be worth just commenting.
Yes, yep. So Clayton, if you're able to drop me an email about that, then that's absolutely fine. The CQC have said about just going via email if you're unable to use the portal, but they have said that they're hoping to get it up and running as soon as possible, and that they'll send a communication to care providers to let them know that it's functioning. Leah, did you want to come in?
Hi, can you hear me?
We can, yes.
Okay, great. Yeah, I was just wondering with regards to the PDF, so what you've sort of gathered, I'm gathering from the PDF to create these. Where do I find that so that I can continue with each quality statement and create a bit of an action plan of my own?
It is on CQC's website.
Right, I'll go on there.
Yeah, don't put me on the spot and ask me to provide you with a link, because it's some time since I've looked at it. But if I can find it, if it's still there, I'll send it through to Care England and they can share it as well. But I certainly pulled it off CQC website. Certainly every time I go on, there's different information there that hopefully people will find helpful.
Brilliant, that's great, thank you.
Liam, you got your hand up?
I have now. Thank you, Charlotte. I've got a couple of colleagues in the room with me. We have that same issue. We've had it this morning with the CQC portal, insisting on a manager's application going via the portal. We had a separate meeting with some other colleagues elsewhere in the last few days. And the thing I'm picking up, Philippa, is a real disconnect between the senior managers of CQC and what actually happens at the ground level.
Yeah,
so the concern
absolutely.
are that Chris Days of this world and the James Bullions of this world are saying, well, listen, we'll do these things, we'll implement the changes, we're listening to you. And then at local level and at Newcastle NCSC level, they're not actually implementing them. So we corporately decided not to go with the portal. We're not assured by it at the moment. And my question to you in a long-winded way is, where in the regs does it say that one must complete in a portal? What it does say, doesn't it? We are required to provide statutory notification and information in a timely way. Doesn't necessarily say within the CQC portal in the regs, does it?
No, not at all. You just have to provide the information.
So that's the same for an applicant, for a manager, as our view.
Yeah. Then, then there might be any number of reasons why an applicant isn't actually able to access the internet and so can't use the portal full stop. There should actually still be the ability to, go old-fashioned and submit a paper-based application as well. And they should make reasonable adjustments to support somebody if they need to do it in that way.
Thank you. So Charlotte, that's the issues that we need to discuss at a wider level, and maybe we'll do that at the next regulatory meeting, which a number of us are attending, Charlotte. That I think that there is a real disconnect between the top level and the ground level.
Absolutely, and we'll make sure that we cover that off.
Yeah, and they're constantly asking for feedback. I mean, I get all the emails that everybody else does from CQC, and it's always like, we want your feedback. Tell us what's working. Tell us what's not working. It's like none of it's working.
Thank you. Thank you.
Jane's got her hand up. Jane, would you like to come in?
Sorry, I'm having problems with my computer. Just to let you know that I applied, I'm a new registered manager, applied online prior to March, rang CQC up yesterday. They didn't put my paperwork into the new portal, so now I'm left having to go onto the new portal to redo my application. So they've informed me today not to use the paper format. So I'm sort of a bit left what to do now, to be honest.
I'm sorry to hear that, Jane. I think there are lots of people that are having fights at lots of different levels. Are you able to access the portal? Are you able to go down that route?
No.
Well, I would push back to them then. I would go back through the contact centre, go back through the people that you're talking to, copy the wilderness dog in, find the email addresses for people as high up as you can in CQC and just bombard them with information to say, this doesn't work and, you're not making reasonable adjustments to make it work.
Okay, thank you.
Can I just say, sorry, their email addresses are their name with a dot in between. So their first name, their second name at cqc.org.uk. So say you want James Bullion to be copied in, you write james.bullion@cqc.org.uk. I know that because I previously worked at CQC.
Thank you.
And it will get to them.
Thanks, Jo. Dan.
I was just going to add, if you are sending emails to CQC, make sure you tick on the delivery and the read receipt option, because we have experience in the past where CQC have said it hasn't been received, even though we've had a reference number which is automatically generated through their system. So at least you've then got the evidence to show there was a read receipt and it was delivered.
Thank you. Have we got another hand up? Oh, it was Jane giving a little thumbs up. Has anybody else got any final questions or comments for Philippa? Doesn't look like it. So thank you all very much for your time, and a really big thank you to Philippa. That was a really, really fantastic, really useful webinar. So thank you very much. Lots of really, really lovely feedback in the chat as well. So yeah, we really, really appreciate your time. We will make sure that the slides and the recording are shared to attendees, and we'll also be in touch about the rest of the series of this webinar as well. So you can make sure that you're tuned in for those. Thanks all.
Thank you. Thank you.